Hello, everyone. Sorry, we had a couple technical difficulties on my side of the webinar, but everything is fine now and we're ready to get started.
All right, so let's get started as it's 12, a little after 12. The voice you are hearing, the disembodied voice, is Dr. Erin Hinson, one of the good doctors, and that was Dr. Kristen Donnelly, whom you'll be hearing from in a few minutes as well. But welcome to our COVID-19 Future Forecasting Emotional Coping Strategies webinar. And when we were deciding to start doing this webinar series, we broke them up into 3 different webinars. It just so happened that the Emotional Coping Strategies webinar fell on the Monday in which Dr. Kristen and I were supposed to be returning from Ireland from one of our best friends' weddings on the 4th of April, which, because of all of this, has not happened and has been postponed, both our trip and the wedding, into the foreseeable future. So we thought it was rather apt to be talking about different ways of emotional coping strategies as all of our lives have been disrupted. So let's take a look at what we're going to do in this webinar. This is one of my favorite memes that I've found from this period of history. If anybody is a fan of Star Trek: The Next Generation, you will know. But even if you aren't, you can get the gist of it. We're going to really briefly talk about who we are. We're going to start using the language early on in this webinar of looking at this as a war or a conflict, and we'll explain why a bit later on. But we're going to talk about this war that we're all waging against an invisible enemy. We're going to look through some ideas and some helpful graphics we've found about mental health, talk about some long-term impacts we could be facing from COVID-19. And then the last part of the webinar, we're going to be focusing on our research experience and expertise, living and working in conflict zones around the world, but most specifically in Northern Ireland, and some lessons that we think are helpful from that conflict. And then at the end, we will try and find some joy and some brightness and some at least helpful tips on coping with emotional trauma as we move forward. So really quickly, if you don't know us at all, you're very welcome to the Good Doctors. I am Dr. Erin Hinson. I have the curly hair in this photograph.
And I am Dr. Kristen Donnelly, and I've got the glasses.
We met while doing our doctorates in Northern Ireland almost 10 years ago. We have a lot of experience in research and business, but for today specifically, we have a lot of experience in conflict and trauma, and coming through a period of societal disruption, prolonged as it is. And so that's what we're going to be focusing on today, bringing that expertise. We have lots of other expertise. If you want to find out about it, we will give you ways to get in touch with us and how we can be helpful. But we're going to skip through that to get to the more important stuff. This is our approach to pretty much everything we do, every way that we teach for Abbey Research and this webinar. We're going to start with some generic ideas and thoughts. We're going to move to the specifics. And then at the end, we always end with action because we want to be able to give you something to work with moving forward. And as we get started into this, I should have said at the beginning, but if you have any questions, we will have time for questions at the end. You can type them into either the Q&A or the chat function at the bottom of your webinar screen, however you're viewing this. And we will, unless it's something immediately that was not understood and needs to be answered during the webinar, we're going to save them for the end, but we do want to leave time to have a bit of a discussion or to ask some questions. So be sure, and if you have them, just type them into the chat, and we'll be making sure to get to those questions. So when Dr. Kristen and I started talking about this webinar and what we wanted it to look like, and talking about what we were facing with COVID-19, we immediately went to kind of the language of conflict and the language of war. And one of the hardest things about fighting this enemy in a different way from ways, wherever you're listening to this, your country has experienced some sort of conflict or war throughout history. There's a lot that we don't know. And it's causing everything to be really uncertain. Every week, every day, every hour, it seems like we get new information. We weren't wearing masks. Now we're wearing masks. We're trying to do contact tracing. We don't have enough tests. So that's one of the most difficult things about this is we don't know how long it's going to last. We don't know when it will end and what that end looks like. So that is already one of a really dangerous kind of mixture of ingredients to create kind of high emotional stress and mental health issues. And I read a really great article that talked about kind of the level of exhaustion we're all feeling every day. And it's, you know, our fight or flight instincts. We can do neither of those things. We cannot really fight. Fighting for a lot of us is, you know, either going to work if we're in one of those fields that is essential to human survival, or we're staying at home. And either way, it doesn't feel as productive as we might want to feel. We can't flight, we can't leave, we can't escape this invisible enemy. It's everywhere. And so what a lot of us are doing is kind of having this emotional response of playing dead, where we just kind of want to sit still, don't do anything, don't disrupt anything, and, you know, maybe fight in that way. So if you're feeling exhausted all the time, having a hard time getting out of bed, we're here to tell you biologically that is a response that could be happening.
So one of the things that I have noticed as I've been watching how people talk about this pandemic is that we're not having a whole lot of conversations right now, which is totally fine, about some of the emotional and long-term responses, as we've kind of already talked about. And one of those is that because we have to be so focused on physical health, because the immediate crisis about the coronavirus is physical health, bar none, for sure. We have not created ways to talk about mental as much, or even some of the other mental health effects of being locked inside, or of children having to now be in homes with abusive guardians, or of spouses having to be in homes with abusive partners, of a lack of food security at home for children who accessed food through school. We also haven't had, and because we're not capable of it, conversations about, you know, the different ways that this is impacting different socioeconomic brackets and all of that. And that kind of feeling of knowing there's more we should be talking about, but not having language for it, is one of the things that will impact from coronavirus, because everything will feel like, oh crap, we should have thought of that, or oh my God, it's awful for that person too. Like every time you think of something new, it feels awful. And so we are having, and that's upon, like, we're at what, 6 million Americans who have filed for unemployment at this point, I think we are. The only reason we're not
6 million last week.
6 million last week. So we're probably looking at 8 to 9 this week at the rate of multiplicity. And the only reason we're not using recession language is because recession is marked by time. It's not marked by amount of loss in the stock market. So we'll be talking about there's absolutely no way we're not in a recession. I mean, come on, just look at the numbers. So we're going to keep facing all of these things on this graphic. And for people who never faced mental health challenges before this pandemic, the things on this chart might be very new. For people who are already in a place where balancing and wrestling with and interacting with their own mental health is a day-to-day or minute-by-minute battle, all of that is increased. People who already have agoraphobia and are struggling to try to leave the house more clearly can't right now. A lot of people with, even with eating disorders, or people with generalized depression, folks with dissociative disorder, these are all very, very, very dependent on routines, and none of those routines are possible right now. And so this is all really, really difficult. Dr. Aaron found a really great article that we will make sure to put in the show notes about how we are now currently stuck in an everlasting present. And so we don't have any idea what's happening, and that's a big part of the mental toll. So the long-term impact, There's lots of them. The relationships with our family and friends and community members. We've talked about it in last week's webinar, but what happens the first time someone tries to go to the grocery store and they find somebody who sneezes in their hand and then touches a shelf or something? How individuals react to that kind of thing is going to be different. We're probably looking at an increased amount of emotional responses, fear and paranoia. There's absolutely going to be an increased a continued increased role in government, especially if we go to phased social distancing like some talk is right now. Travel patterns are going to be very different. Dr. Aaron and I both have jobs that require quite a lot of physical traveling, and the question of if that's even possible and when will that be possible again and what does that look like. The social support systems, as you know, right now, in the United States, the CARES package is the big conversation about a government stimulus. But there's lots and lots of small things and ways that bill probably won't help direct people immediately. There are going to be people that fall through the cracks, especially those who are potentially getting support directly from nonprofits that I guarantee you most of have seen their funding streams dry up in the last couple of weeks. So there's lots and lots of things that are going to be happening. COVID, I don't think is going to be a history lesson for a long time. I think it's going to be a present tense thing for a while, and we will continue to keep learning all those lessons. But hey, guess what? Even though this feels unprecedented, it's not in some ways. It may be completely unprecedented in terms of like the data and what we're facing, but it's not unprecedented in terms of human emotional reaction. That was a lot of really overwhelming information, but take a deep breath because now we're going to talk through some things that we can expect and therefore prepare for. And we are of the mindset that being prepared is a good chunk of the battle.
That's right. So these are kind of some lessons that Dr. Kristen and I brainstormed as this was several weeks ago as kind of the start of these physical distancing rules and isolation rules were rolling out across the state and the country and the world. And we started to talk about the long-term effects that Dr. Kristen just went through. And we started to talk about it in the framework of what we've learned from Northern Ireland. Both of us did our PhDs there. Both of us have been studying Northern Ireland for over a decade. And the prolonged ethno-national conflict that took place there violent conflict for roughly 30 years. But many of us who study and live and work there know that the conflict has never really ended. It's just changed into a different form. But one of the first lessons that we talked about when we were brainstorming for this webinar was this idea of making the abnormal normal. Because we do as human beings crave routine in some form, whatever that looks like for whoever you are. But some sort of structure to our daily lives. Very few of us are actual anarchists in our daily life. We like to have our morning cup of coffee, or we like to alternate the different type of tea we drink every day, but we have a cup of tea every day. So it's really, really hard with all this disruption to find what looks like normal. So, creating any sort of routine is a part of surviving. It's a survival mechanism. So adjusting to the way that you have to go to the grocery store. I've now gone to our Giant Eagle 2 times in the last 2 weeks, and I have my routine set up for when I put on my gloves, how I touch things in the grocery store, how I avoid other people so as not to come into contact with them. And eventually that will become the new normal. And we have to be prepared for the fact that our bodies and our minds will do that in order to help us survive.
So the next thing is a little bit of what I just said, which is that this is going to be present tense for a really long time. And also, after there's an end date, after historians kind of get together and say this ended on blank date, we enter into long-lasting generational trauma. This is massively true for societal changes. And just for the record, I've heard some people really push back on the idea of referring to this as a war because they see the word war as some sort of value judgment, which sociologically, I don't really engage with that idea of war as a morality judgment. What I'm interested in is the long-term disruption that a conflict is, which is what this is. This is long-term, unilateral disruption that affects people disproportionately and usually without their control based upon the decision of others, which is, for me, one of the major definitions of the societal ramifications of a conflict. And one of the other societal ramifications is this long-lasting generational trauma. This is not how people react to this now if it is not dealt with. It may involve behaviors, mindsets, or other things that they pass on to children. Additionally, people who pass away from this disease, or people who pass away from ramifications, someone who dies by suicide, or somebody who died from diabetic complications because there wasn't a bed left in the hospital because of COVID, like all of these kind of tentacles, as it were, are not things that go away when society decides we're done. These are long-lasting things that kind of happen. And we have discovered in working with some of the folks in Northern Ireland, especially our peers, one of our best friends, who's also a researcher and is a historian, talks about how she wishes, and she's somebody in our generational peer group as well, that she had been kind of told that generational trauma was a thing, that just because she wasn't alive during the conflict doesn't mean that the conflict didn't affect her. And that's really what this is. When we're looking 30 years from now, there's going to be people born next year after this is quote unquote maybe over, or 2 years from now, that are potentially still going to be feeling the side effects or the ramifications, and we need to be prepared for that.
And this kind of ties in with the last one, and it's a very, very difficult one. And I know I struggle with it. I know Dr. Kristen has talked about struggling with it. And it's this idea of what to do with the negative emotions that we have, right? Like, so I've phrased this as don't play the blame game. But it's really, really hard to know what to do and to manage the negative emotions that come from you know, seeing how possibly state officials or government officials are responding to this, to seeing photographs of, you know, crowded beaches in Florida a few weeks ago. I had a real hard time with that, everybody. I was very, very angry. And I said some very mean things about those young people because they insisted on their need for a spring break. And that's going to be a really huge challenge for us moving forward, is what to do with these emotions and how to manage them in a way that is not destructive to other people or to ourselves. And so what we're saying is, you know, try as best you can not to blame other people for, you know, what happens. There are going to be people to hold account to this. We will definitely have people that we can hold accountable for things that they did and did not do, particularly a lot of people in leadership positions in a lot of places around the world. You know, we're here in America, and we're seeing quite a range on the spectrum of what leadership and accountability looks like. But that's true for people around the world. But as best we can for individual humans that we know and see in our everyday lives, it's going to be healthier for us in the long run if we can mitigate those negative emotions about their actions. And we've got a great graphic coming up that will kind of highlight that more. But it's a lot about what we can and can't control. You know, we can't control the actions of other people. We can hope for the better part of humanity and the better instincts of humanity to win out over this. But there will be people throughout this traumatic event, however long it lasts, that will not adhere to the social rules, that will put people's lives in danger. But coming through the other side of this, whatever that looks like, for our own mental health, it will be as best as we can. And I've mitigated this a lot because it's hard to say, to manage those negative emotions in the healthiest way that we can.
Oops, sorry. The final thing, and we won't kind of harp on this a lot because this is kind of simple to say, we have a tendency as human beings to put suffering in a hierarchy. This is the people at parties that do the one-upper game when something terrible happens. Oh yeah, that happened to you, but wait, this happened to me. There's a lot of us that do that, even if we aren't the overstepper at parties. And it's really true in a massive conflict like this. We are all victimized by this thing. We are all suffering on some level. There are people who have already disproportionately interacted with this disease in a way that some of us will never know. This is one of the things right now in which, like, people who are in countries or parts of America that are in stricter lockdowns, you hear on social media that it's like really difficult for them to look at Instagrams of other parts of the world and everyone's still at restaurants, because it's like, okay, well, if you're doing that, then you're not as much of a victim as me because I'm on lockdown and this is really hard and all this kind of stuff. We really have to try the best we can to not create that. We are all, the more we say we're all in this together and mean it, we create comprehensive support mechanisms. And this is kind of the thing where it's also a really good time to realize that there are people who have been here before and know their way out of it. So there are people who have already been figuring out how to live in trauma for a lot of years. There's lots of people that have PTSD and would love to share with us. And I'm hoping specifically, and I think I can speak for Dr. Aaron on this, we haven't talked about it, that some of these very proscriptive listicles of here are the things you must do turn into more of here are the things that work for me, maybe they'll work for you, and we can kind of create more of an international idea bank of comprehensive support mechanisms as we all move forward.
So let's get to possibly some of the ways that we can mitigate this absolute disaster that we're living through. And this is kind of one of the first one on this list of coping is a hill that both Dr. Kristen and I are willing to die on these days. I cannot tell you the number of times I have heard people say, when we get back to normal, when we return to normal, when this all goes back to normal. And I think it's a coping mechanism. I think we need to believe that it will not always be this way. And it won't. It will not always be this way. This will end at some point. We will develop a vaccine. We will develop antibodies. We will come through this at some point. But I think the idea that normal is what we're going to return to is something that needs to be stopped. We will create new normals. We will go back to some semblance of the life that we had, but this crisis will dramatically alter the way we live, possibly every day, the way we interact with others, the way we communicate with our family, all of these things that we've been talking about. And the other thing, we talked about this, kind of these listicles that keep showing up, telling everyone what they need to do to survive. And they tend to be very definitive or very prescriptive, as Dr. Kristen said. Routines can help us build a sense of normality, which we talked about earlier in the webinar. But, be aware that those need to be flexible and that your routine might be very different on Monday than it is on Tuesday. But if you need to build a sense of a couple of things that will help you structure your life or the life of your loved ones that you are caring for or living with or worried about, that's great. If that routine goes absolutely to hell one day because you wake up really upset, that's normal too. We're here to say from professional experience and personal experience, the more pressure we put on ourselves to adhere to the routines, that's going to have a knock-on negative mental health effect as well. If it's what you need and it helps you, great. If it breaks down one day, don't blame yourself. You didn't do anything wrong. That's just how you're surviving on a given Thursday that might be very different from your Monday, Tuesday, and Wednesday.
Just like Dr. Aaron said, this is the graphic that we've personally found really helpful. It's been flying around the internet at a couple different rates of speed and time. So we have been sharing it frequently. As you are learning to make these healthy choices for you, both emotionally, physically, and mentally, as you are in this process, please remember that if you are not harming yourself or someone else, there is no real right or wrong way to cope. I have tried very hard to, for instance, limit the news. I can't turn it off because for me, part of my job means that I do want to stay quite informed, but I don't need to stay as informed as I was the first week, and I can limit things because I can control how much of that I follow. I cannot control the people that I still see playing in the park when I drive home and I would like to yell at the car. I can't do that. I can't. But I can control how I react in that moment, which currently is to turn up my podcast louder and forget that that's happening. So coping is a dynamic reality, and therefore we would encourage you as strongly as we can to give yourself grace in that dynamism.
So these are some tips that we shared last week in our webinar, but as we were working on this week, we found that they pretty much stayed the same for both long-term and short-term kind of coping strategies in the everyday. Be gentle with yourself and others. Try as best you can to be non-judgmental, both of yourself and the other people that you see. Everyone is struggling. Everyone is dealing with this differently. Everyone has varying levels of self-awareness or emotional intelligence. So they might not understand why they're feeling or acting the way that they're doing in a similar way that you do. So that's the number one thing we can all do every day, is to find a little bit of grace.
The next two are pretty connected, which is that like people have been saying, socially distancing does not mean socially isolating. Talking about how this is impacting you, reaching out and staying connected to other humans. Even just yesterday, I was having a really hard day of reframing my brain around the word productive. And I hopped in the WhatsApp chat that Dr. Aaron and I have with 3 of our best friends. And they immediately just came back at me with, no, like, here's how you need to reframe this. And that's how I needed to be talked to. And they know that because they love me and they know my brain. And it was so helpful in reframing and taking a breath and remembering that I don't need to have the same definition of the word productive that I normally do, and that's okay. So we would kind of, this can be part of a routine if that works for you, but we would encourage you to think about staying in touch with folks as much as you possibly can.
And we've talked about this first one here on this slide a couple of different ways in this webinar, but finding some form of stability, but being flexible about it. I practice yoga as a way to help with my emotional health and my mental health. That has been disrupted significantly, but I'm finding a new routine. I now have yoga classes on Tuesday nights and Friday mornings and Sunday mornings. This is the first and second week of that, and it's starting to feel like this is that new normal. But if I wake up next Sunday and I can't do that class, that's okay too.
This is a good lesson for a lot of us, even without a global pandemic, but embracing imperfection. There's a lot of things that are fine, and that's fine. Enough is a really good word that we don't embrace as often as we should. None of us are going to be doing an A+ job at this, except if by the very existence of following instructions. If you are staying at home as much as you can, socially distancing, washing your hands, following CDC or whatever your government equivalent is, then you are doing a great job at this pandemic. A+.
We are here to give you a badge.
A badge. We will help you unlock an achievement. You're doing a great job. And that's it. That's all we're required to do every day. And embracing the mess of that is a really important thing. And the next one I'd like to speak to just really gently to all of my fellow productivity junkies. Productivity is allowed to look different right now. My to-do list used to have long things about budget reports and making sure that I connect with so-and-so over this project or booking this worker to come in and take a look at this thing in our building. And right now it looks like playing, this video game that gives me calm, or sending this gift to this person because it might make them laugh. And that is productive. And that it will remain productive after this, but that's a separate webinar.
Yes, and that I just wanted to add from the quote that I sent Dr. Kristen this weekend when she was having a panic about being productive. The one line in this quote was really great. Boredom is a productive state so long as you don't let it go sour on you. Try not to confuse the urge to get something done with the idea that you are useless. Do the thing or don't do it. Either is fine.
Amen. So how can we help you as we go forward from here? We would love to let you know that there's a lot of us on YouTube.
We make a lot of videos.
We make a lot of videos. If you find us entertaining and or charming, we have done lots of funny videos. We've also done a lot of television reviews. If you are taking this time to dive into either The Crown or The Handmaid's Tale, for instance, we have episode by episode recaps for you. Also, on a more serious note, we have done a lot of white papers on issues about the pandemic and also other issues moving forward, as we're just still humans who work with other humans.
Yeah, that has not changed.
That's pretty much our business. We help humans work with other humans. That's the business model. Yeah. So as we figure about remote working and social changes and business changes in COVID, but we've also got stuff around conflict management in general and generational issues and all the other kind of ins and outs of working with other human beings.
Alrighty, so I know we've gone a few minutes over. We started a few minutes late as well, but we did want to leave time for questions. So if anybody has any questions from what we've talked about, pop in the chat. We've got one in the Q&A, I know, from Cheryl, talking about a way to highlight the voices and knowledge and experience of people who have already battled mental health issues, which I think Dr. Kristen talked a little bit about. But I think, yes, hopefully what I would like to see is a comprehensive way to look at people who have experienced this in some way, shape, or form, sharing their experiences, sharing their tips, and the way that they've gone through it. I would love to see a comprehensive discussion about mental health when we come through this. And as we're grappling with what society looks like on the other side of this pandemic, I think there's a lot to be learned from people who have already experienced levels of trauma in whatever shape that trauma took. And here, here's hoping for it. I think it would be a wonderful thing. I tend to be more skeptical, but I would love to see it.
Yeah, and we'll certainly do what we can. I have a lot of kind of memoirs that I've read and things like that I'd be happy to throw together a recommendation list, because I think learning to listen to other voices as just full stop that aren't in your day-to-day life is a really important practice that we can all cultivate. Mm-hmm. And that's certainly a goal here at Abbey Research. So, I mean, Cheryl, there are people that know what this feels like. And we should be absolutely listening to them. How do we promote that? Well, the best way I know how to do it is to tell you guys to read The Glass Castle and stuff like that. But that may or may not work for other people. And so we'll be figuring out how to represent voices on our end. When we have the mental capacity to recommend documentaries again, we'll certainly be thinking about that. And other blogs or things as such. But if you are somebody who speaks to groups of people, lunch and learns, or you have a college class and you could have people Skype into it, think about those kind of conversations, especially for anyone teaching university right now who's maybe trying to figure out how to do that for the next 3 weeks. Find somebody who's been blogging about this or tweeting about it or Instagramming about their mental health in this time and give them 10 minutes to your class. It wouldn't be the worst idea. So that's kind of where I think we should go.
There's a lot of voices out there of people who have shared their experiences. So we would encourage you to find them. And if you need help, we're here to help direct you.
Absolutely. And this is how you get in touch with us. If you're watching this on YouTube, you can comment directly underneath it. If you're joining us live, then we are Abbey Research across every social media. Shockingly, no one else has taken this name. And we'd love to chat. we are both behind desks all day. So come and help us help you.
Yep, that's all we've got. Thank you so much for joining us, everybody. Be safe and be well, and we will see you next week for another webinar if you're around.
We are still debating on the topic, but we're planning on giving you guys a webinar for weekly, if not every other week, for as long as the national kind of lockdown lasts.
That's right.
So see you guys later. Bye.
Bye.